Stand in front of a mirror. Raise both of your arms straight out to the sides, parallel to the floor, palms down. Look at the area underneath your upper arm, between the elbow and the armpit. The skin and tissue hanging there, the part that moves when you wave, the part that has slowly grown softer and looser every year since you turned 50. You have been told it is fat. Lose weight, your doctor said. Cut back on the bread, your friend said. Cardio, said the trainer at the gym, 3 years ago before you stopped going. None of them were right. The thing hanging under your arm is not, in over 90% of cases, fat. It is the visible signature of one of the most common, most overlooked, and most reversible changes that happens to the human body after 60. And almost no doctor will ever tell you what it actually is, because the fix takes 10 minutes a day, and there is no pill to prescribe for it. In March of 2025, a body composition study published in the Journal of Cachexia, Sarcopenia and Muscle examined over 11,000 adults over the age of 60, using high-resolution imaging to measure exactly what was happening in the upper arm. The findings overturned decades of assumptions. In adults over 60, with visibly saggy upper arms, the average body fat percentage in the upper arm region had increased by only about 3 to 5% compared to their younger years. 3 to 5%. That is the equivalent of about half a tablespoon of fat. It is essentially nothing. The real culprit was something else entirely. The triceps muscle, the long, thick muscle that runs along the back of the upper arm, had shrunk by an average of 27%. 27%. More than a quarter of the entire muscle had simply disappeared, replaced by nothing. The skin and connective tissue that had been stretched over that muscle for 60 years now had nothing underneath to support it. So it sagged. The sag is not fat that got added. It is muscle that got taken away. This matters far beyond appearance. The 15-minute appointment will never bring this up. Your doctor will weigh you, check your blood pressure, and ask about your medications. They will not assess your triceps. They will not check your grip strength. They will not measure how easily you can rise from a low chair. These are the markers of a condition called sarcopenia, the medical term for age-related muscle loss, and it is one of the strongest predictors of how long you will live and how independent you will stay. After the age of 65, sarcopenia is more dangerous than obesity. It is more dangerous than mild high blood pressure. It is more dangerous than mild high cholesterol. And it is invisible until the day you cannot push yourself out of a chair without using your hands. This channel exists to teach you what the appointment cannot. There is no money in showing you how to rebuild your muscles. There is money in the assisted living facility, the walker, the wheelchair, the hip replacement. Subscribe and hit the like button right now. I am Marsden Hale, and we are pushing for 1,000 subscribers in the first 90 days. Every single click matters. The algorithm will show this video to one more person who has been staring at their arm in the mirror and blaming themselves for the wrong reason. Let me explain what is actually happening inside your arm, in your back, in your legs, and in every other major muscle group every year after the age of 50. Muscle is not a permanent tissue. It is a constantly rebuilding tissue. Every single day, your body breaks down a small amount of muscle protein and rebuilds it. In a young, healthy adult, the rebuilding rate slightly exceeds the breakdown rate, or matches it perfectly. The muscles stay full. After the age of 50, two things change. The breakdown rate accelerates, especially after periods of inactivity, illness, or hospitalization. And the rebuilding rate slows down, partly because of declining hormone levels, partly because the body becomes less efficient at using dietary protein. The math turns against you. By the age of 70, the average sedentary adult has lost between 30 and 40% of the muscle mass they had at age 40. That muscle does not come back on its own. It only comes back when you actively rebuild it. Cause 1. The first and most important cause of the saggy upper arm is the death of the triceps. The triceps is responsible for almost every pushing motion you do. Pushing yourself up from a chair, pushing a door open, pushing a grocery cart, lifting yourself from a bed, holding a coffee cup steady with the elbow extended. When the tricep shrinks, the daily pushing tasks get harder. You compensate by leaning, by using both hands, by avoiding low chairs entirely. Each compensation reduces the demand on the triceps even further, and the muscle shrinks faster. This is the spiral that ends in a person who cannot get off the toilet without grab bars at 75. The good news is that the triceps responds to training within 4 to 6 weeks at any age, even past 80, and the muscle volume can be largely restored within 12 to 16 weeks with consistent, simple work. Cause 2. The second cause is the loss of collagen and elastin in the overlying skin. As muscle shrinks underneath, the skin loses 2 of its main structural proteins as well. Collagen, which gives skin firmness, drops by roughly 1% per year after the age of 30. Elastin, which gives skin the ability to snap back after being stretched, decreases dramatically after menopause in women and gradually in men. The skin becomes thinner, looser, and slower to return to its original shape. So even when you rebuild the muscle underneath, some loosening of the skin may remain. The honest message is this: you can dramatically reduce the sag by rebuilding the triceps. The skin will tighten somewhat over the muscle as the muscle fills back in. But total reversal to the appearance you had at 30 is not a realistic goal. The realistic goal, the meaningful goal, is to rebuild the muscle, restore the function, and improve the appearance significantly. Cause 3. The third cause is anabolic resistance. This is the technical term for a phenomenon that affects almost every adult over 60. The muscles become less responsive to dietary protein. In a young adult, eating 20 grams of protein at a meal is enough to trigger a strong muscle-building response. In an adult over 60, the same 20 grams may produce almost no response. The threshold rises. Most adults over 60 need around 30 to 40 grams of protein at a single meal to trigger meaningful muscle protein synthesis, and they need to hit this threshold at multiple meals per day. The average older adult eats roughly 15 grams of protein at breakfast, 20 at lunch, and 30 at dinner. None of those meals individually crosses the threshold for muscle building. They are essentially starving the muscle of the building blocks it needs. Quick question before I continue, because your answer genuinely shapes the next videos. Right now, today, can you stand up from a regular kitchen chair without using your hands or arms at all? Just your legs. Write yes or no in the comments. I read every reply in the first 24 hours. The answer tells me whether to make videos about preventive maintenance or about active rebuilding. Tell me, yes or no. The fourth cause is the silent inactivity that hides inside an active life. Many older adults consider themselves active. They garden, they walk the dog, they run errands, they cook, they do laundry. None of those activities, however, place a meaningful load on the major muscle groups. Walking the dog at a comfortable pace does almost nothing for the triceps, the quadriceps, the back muscles, or the chest. The muscles only grow or maintain themselves when they are challenged with a load that approaches their current capacity. The technical term is progressive overload. Without it, the muscles atrophy regardless of how busy your daily life feels. The average older adult dramatically underestimates how sedentary their actual muscle loading is, and they will tell you with complete honesty that they are very active while their muscles continue to disappear. Cause 5. The fifth and final cause is the hidden inflammation. Chronic low-grade inflammation, the kind that comes from poor sleep, abdominal fat, ultra-processed food, untreated dental issues, and chronic stress, raises a set of inflammatory markers in the bloodstream that actively block muscle protein synthesis. The body cannot build muscle in an inflammatory environment as efficiently as in a calm one. Reducing chronic inflammation through sleep, through whole foods, through stress reduction, and through treatment of any chronic infection, is the unglamorous but powerful background work that makes everything else effective. Step 1. The first step in reversing the sag is the daily triceps work. You do not need a gym. You do not need weights. You do not need a trainer. You need 10 minutes a day, every day, for 12 weeks. The exercise is simple. Stand in front of a sturdy counter at hip height. Place both hands on the counter, shoulder width apart, fingers facing forward. Walk your feet backward until your body is at a roughly 45-degree angle to the floor, like a standing push-up. Bend your elbows and lower your chest toward the counter. Push back up. Keep your body in a straight line from head to heel. That is 1 repetition. Do as many as you can with good form. Stop when your form breaks, not when you feel tired. Do this every day. In the first week, you may manage 5 repetitions. By the 4th week, you will be doing 15. By the 12th week, you will be doing 30, and you will need to make the movement harder by walking your feet farther back. The triceps fills in, the sag reduces, the arm regains shape. None of this requires equipment. Step 2. The second step is hitting the protein threshold at every meal. 30 to 40 grams of protein per meal, 3 meals per day. For breakfast, that means 3 eggs plus a cup of Greek yogurt, or a protein shake plus a slice of cheese. For lunch, that means a palm-sized piece of chicken or fish, plus a serving of beans. For dinner, that means the equivalent of a deck of cards of meat or fish, plus a side of legumes. Vegetarians need to be especially careful because most plant proteins are incomplete, meaning they lack 1 or more of the essential amino acids that the muscles need. A vegetarian over 60 trying to build muscle should pair their plant proteins thoughtfully and may benefit from a daily scoop of a complete plant protein powder. Hydration matters too. Muscle building requires water. 2 liters per day, more if you are active. Step 3. The third step is the weekly resistance progression. The counter push-up is the entry point. After 8 weeks, when the counter push-up feels too easy, progress to a wall push-up against the kitchen wall with your feet farther back. After another 8 weeks, progress to a knee push-up on the floor. After another 12 weeks, progress to a full push-up on the floor if your wrists and shoulders allow it. The body adapts to the load you give it. Each progression triggers a new wave of muscle growth. This is true at 60, at 70, and at 80. The research is clear. Adults in their 80s who start a progressive resistance program for the first time see significant muscle gains within 12 weeks. The body never forgets how to build muscle. It just needs to be asked. Step 4. The fourth step is the daily walking with intent. Most older adults walk. Few walk with the kind of intent that loads the lower body meaningfully. Add 10 minutes of brisk walking each day, where the pace is fast enough that you cannot easily hold a conversation. This works the legs harder, raises the heart rate, and improves circulation to the muscles you are rebuilding in the upper body. The two reinforce each other. And here is the trap that catches everyone who tries this. You feel sore the second day. The muscles you have not used in 15 years are waking up. You assume something is wrong. You stop. 2 weeks later, you have lost the small momentum you built. The soreness is not damage. It is the muscle telling you that it noticed for the first time in a long time. The soreness fades within 3 or 4 days of consistent work, and what replaces it is the slow, gentle feeling of strength returning. Push through the first 10 days. Do not stop because of mild soreness. Stop only if you have sharp joint pain, which is different and is a signal to modify the movement. I want to be direct with you about one specific thing. After the age of 70, the leading cause of loss of independence is not stroke. It is not heart attack. It is not cancer. It is muscle weakness. The inability to rise from a chair. The inability to climb stairs without a rail. The inability to carry a bag of groceries from the car to the kitchen. Once those simple tasks become difficult, the world starts to shrink. The home becomes the only safe space. The car gets used less. The independence built over a lifetime erodes within months. The saggy upper arm in your mirror tonight is the visible warning sign of a much bigger story. The fix is the same, regardless of whether you care about the arm itself. Rebuild the muscle. Hit the protein threshold. Progress the load. Keep moving with intent. The arm will tighten as a side effect. The years of independence are the real prize. How old are you, and how long has it been since you did any kind of resistance training? Write your age and a rough estimate in the comments. 65 and never. 70 and 20 years ago. 80 and last year. I genuinely use these numbers to decide which conditions to prioritize next. Sarcopenia at 60 looks different from sarcopenia at 75, and the protocol shifts based on where you are starting. Tell me. I will read every one. Nobody is going to call your house tomorrow morning and stand beside you while you do your first 10 counter push-ups. The system does not work that way. There is no fitness referral on your prescription pad. The decision to start today and the willingness to feel mildly sore for a few days is on you and you alone. Help Dr. Hale reach 1,000 subscribers. Subscribe, leave a like, and send this video to the one person in your life who has been blaming themselves for an arm that was never about fat in the first place. The body forgives a great deal if you act in time. The triceps does not care that you are 70. The triceps cares that you ask it to work. Ask it today. I am Marsden Hale, and I will see you tomorrow.